Does Tylenol cause autism? You're going to find out today on the David Rutherford Show. I'm here today with investigative journalist from the Daily Caller, Emily Kopp, who dropped an article that absolutely just melted my brain around this Tylenol autism thing. So, Emily, thank you so much for coming on. Is this story true? And is there a greater conspiracy that we're unaware of?
As mind melting as this story is, it is absolutely factual. We at the Daily Caller News Foundation take factual reporting very seriously. This went through, I'll be honest, a bunch of edits that was sort of frustrating for me as a reporter that wanted the story out there, but we needed to make sure that we had all of our ducks in a row because, of course, this story has massive implications. But I read hundreds of documents related to Ken View, the maker of Tylenol. And in this most recent story, looked at FDA epidemiology report after FDA epidemiology report, several memos, and they all had the same conclusion going back to 2016, that we need to issue some sort of communication to pregnant women about the risk of taking this drug in pregnancy. And instead, FDA higher-ups suppressed the recommendation year after year.
I mean, that was the part in your article that really just leapt out at me, and it was this section. I'm just going to read it verbatim. An internal memo reveals that the agency first began examining acetaminophen in pregnancy 11 years ago, in May 2014, after an April 2014 study published in the Journal of American Medical Association raised concerns about the drug and ADHD-like behaviors, prompting its sole statement on the issue for the next decade. And in 2015, FDA webpage that acknowledging that, quote, the FDA is aware of concerns, end quote, and citing that single study. Less than 2 years later, in October 2016, FDA senior medical officer Andrew Mosholder had reviewed 8 observational studies with 7 showing an association between acetaminophen and issues including attention deficits, delayed motor development, and autistic behaviors. When we had the big press conference at the White House with Kennedy, Dr. Oz, and the president, the pushback that I saw immediately afterwards was citing this one report. It's one report. It's one report. But what you're saying is that this senior medical officer, Andrew Mosholder, he reviewed 8 other studies, and there was a much greater consensus that this was going on. Can you talk through, one, how you found those, what documents, and then where you started to see the string of, I guess, cover up is the best word to use, or using tactical language to push it down the road, so to speak?
Yeah, absolutely. Well, I think one thing that we should note is that one report was actually what they call a meta-analysis. So it looked at a bunch of different reports in the scientific literature, said, okay, which ones meet this rigorous criteria, and let's summarize the findings of them. And so that one Harvard report that Kennedy cited and that a bunch of people, as you mentioned, were being critical of, was actually a summary of a bunch of the scientific literature, which we can see from these internal FDA reports were accumulating over the last decade or so. And that very first report that sort of kicked off FDA reviewing the evidence, it should be noted, was published in the second most prestigious pediatric journal in the country. So this isn't some preprint that hasn't been peer reviewed. This is rigorous science published in a journal that the FDA couldn't ignore. So the FDA launches this internal review of the science, and their top reviewer of drug safety for over-the-counter drugs produces another meta-analysis and shows the science is credible. And he's very careful. He says the association between Tylenol use and apparent neurodevelopmental damage is consistent across these studies, but it's not yet causal. So we can't say for sure. The studies simply aren't uniform enough, and they're not designed to suss out whether it's the precise cause. But he says the association is consistent enough that we really need to start informing women about the risk. We just need them to make informed decisions. At the same time, we need to tell them that these other over-the-counter painkillers have their own risks, and that they shouldn't have high fevers and, not be taking anything to treat their high fever. So he's not calling for, a public relations campaign against Tylenol or anything like that. He's just saying we need to warn women about the potential for a risk. And instead, what happened is FDA did nothing. They released one statement in 2015 about a bunch of different over-the-counter painkillers, and they say, we're aware of some concerns related to ADHD, and they cite that first report in the second most prestigious pediatric journal in the country. As more and more studies accumulate, and as privately the FDA is reviewing these studies and finding them credible, FDA issues no further public communication. And so the documents that I reviewed, they're the internal FDA reports that were obtained via FOIA by this law firm that launched a class action lawsuit against Kenvue. And the reason I started reading them is because, I talked to a lead attorney for the plaintiffs, for the parents who feel that their children were affected by Tylenol use. And he was like, sort of citing certain studies. And I was like, are those studies public? Are those emails that you're mentioning public? And he said, well, we obtained them in discovery or via FOIA. And I said, I would like to read them. And he said, are you sure? It's like hundreds of documents. And I was like, yes. So they just literally sent me their whole docket. They didn't point me to, specific documents. And in fact, just for my own integrity as a journalist, I didn't want to work too closely with the firm. So I just read every single document that I could get my hands on. And these FDA reports clearly, stuck out.
Wow. For me, as I looked and I thought, one of the things that is just really cool about your reporting is that you do add in all of those counter arguments, right? It wasn't really clear how many doses of Tylenol were taken. The amount of how often they were taken, and I thought that was brilliant reporting there. It was really cool to see. But the other aspect, to reinforce what you're saying is, man, when you get access to something like a class action lawsuit, that's got to be like gold for you as an investigative journalist. What did you learn? Because some of the documents that you did post were incredibly redacted. How much of what you got access to was redacted? Do you think there's a lot more that needs to be unredacted? And hopefully, Kennedy will hear more about this. And as the hopefully growing storm grows from your reporting, that they'll come out and release some of these. What did you find in those documents?
Well, first of all, I appreciate your praise of me trying to be even-handed on the science. That's something that we discussed a lot internally here at the Caller. And I know that this is an important issue to so many families, and I want to make sure that the science here isn't ironclad, but it is concerning enough that FDA, scientists, rank and file scientists were saying internally that we should issue some sort of warning. And FDA higher-ups who, in many other instances of FDA scandals like the opioid crisis, did the public relations bidding of the pharmaceutical industry. That same pattern to me appears to have occurred here, where the concern about public relations and about a relationship to the pharmaceutical industry outweighed a concern about giving the public full information. And that definitely plays out in the documents. As you mentioned, there are a lot of redactions. One of the reports states that FDA's toxicology division did their own independent studies. So several of these epidemiology reports, they were sort of collating and summarizing other papers, other scientific papers. But it turns out the FDA did its own independent science. And toxicology reports are basically animal studies that look at the, toxicity of a particular drug. And there are certain signals that you can look for in mice to indicate that something is dangerous. For instance, there are certain studies that show that mice and their litter, when exposed to acetaminophen, the mothers stop nursing the infants,
Wow.
which could indicate, some sort of damage there. So what did the FDA find? What were their animal studies showing? We don't know, because for some reason, when the law firm submitted a FOIA to the FDA to find these results, the FDA entirely redacted them. And in my experience as an investigative reporter, obviously I can't say what's underneath those black bars, but in my experience as an investigative reporter, doing work on other issues like the origins of COVID and FOIAing NIH, it's usually an inconvenient fact, right? Or something someone's embarrassed of. And if the science truly indicates that there is no risk here, I think that's something that the FDA should inform the public of. But if there is a concern, then the public deserves to know that too.
100%. I mean, trust me, I used to work for the Central Intelligence Agency, who is probably the most notorious in terms of over 1 billion classified documents, redactions at that scale, right? We still haven't even gotten all the unredacted stuff from the Kennedy assassination and all that, and much less in every other scandal they've been involved in. There were some key players in this that really kind of jumped out at me. And one was the former Food and Drug Administration acting commissioner, Janet Woodcock. Can you talk about her and what you found with her relationship to the sequence of this PR nightmare potentially that they had to manage?
Yeah, so part of the documents that we looked at were describing this meeting in 2018 where this rank and file FDA epidemiologist overseeing the safety of over-the-counter drugs made a presentation to a committee of FDA higher-ups and said, here's the science. For reasons that remain unclear to me, they weren't even considering a label change. Currently, the Trump administration and Kennedy are issuing a label change or initiating a label change which the drug company is fighting. But they didn't even consider that. They just thought, should we, as the rank and file FDA epidemiologist was repeatedly recommending, should we issue some sort of nuanced communication to pregnant women about the potential for risk? And this FDA committee of higher-ups led by longtime FDA bureaucrat Janet Woodcock decided to essentially do nothing, kick the can down the road. They commissioned that toxicology report that we were just talking about that we don't know the results of, and said nothing, remained silent. I think this is notable because Americans at this point, many Americans have a healthy mistrust of the FDA because of
That's an understatement. I think they outright think they suck. I mean, oh my God. I listened to Tucker's latest interview with Dr. Huff, who was a part of EcoHealth Alliance. I almost fell out of my chair. I already have my own suspicions of where it came from. Why? I've been listening to Dr. Malone since day one on all that, right? And had him on the show, talk about it a few months ago. And, and to see this now, it's like, well, it's everywhere you look, right? It's not just, the pandemic of COVID. Now it's Tylenol. Now it's the COVID, it's the mRNA vaccines. How many other drugs in the past were hidden by these bureaucratic officials? And I think we're just seeing another intense reality of, I think, a much deeper basket of potential problems with the Food and Drug Administration, its relationships with big pharma. So were there some other things? I thought I remembered in the article there was some other, I don't want to say scandals, but there are other questionable drugs and other things that she was a part of as well. Is that true?
I think she fits a pattern of a lot of longtime deep state folks who simply occupy a position of power for too long, unaccountable to any election, right? Like, you think about a J. Edgar Hoover, you think about a Anthony Fauci. You're in the same position decade after decade after decade. She was at the FDA for 4 decades. You start to accumulate this bureaucratic power that seems almost unaccountable to Congress, unaccountable to elected officials, because you have been around longer and are more knowledgeable and can play the Washington game better than anybody who could fire you. And I think an interesting contrast is looking at some of the people who are in positions of influence at FDA now. You have a Marty McCary, you have a Vinay Prasad, folks who have been critical of the entrenched bureaucracy and who want to shake things up. And you have the Wall Street Journal calling for their heads. You don't see that with Janet Woodcock, despite her being there for 4 decades. So what does that tell you? It tells you that she was, a creature of the status quo. People will often mention FDA user fees, that the FDA is sort of funded by the industry it's supposed to regulate. I think that definitely played a role in her behavior. And you allude to other controversial decisions that she oversaw. I mean, she was the head of the division of the FDA that oversees opioids for the beginning, middle, and up until very recently, end of there's no end to the opioid crisis, but she was there at the beginning of the opioid crisis. She, led that division at the time of the approval of OxyContin, and then subsequently oversaw the approval of many other dangerous opioids, sometimes overriding the FDA's own scientific advisors to do so. And then as recently as 2020, defended that infamous decision of the FDA to approve OxyContin, saying it followed all of their standards and protocols. So what does that say about FDA standards and protocols? So as I said, I think Americans at this point, post-COVID especially, have this healthy skepticism of the FDA. And there's this attitude, I think, in the mainstream press that how dare Kennedy challenge the science, but I think the responsibility is on these institutions to prove that they are following the science. It's sort of up to them to regain our trust, because there have been so many scandals. And I think top of mind for me right now is, why did FDA officials override the recommendation of one of their top epidemiologists to warn pregnant women about Tylenol? What was the harm in just saying, hey, we're reviewing the science and this is what the science is indicating right now? So that is the multi-million-dollar question from Tylenol is concerned, for sure. And from all the people whose children that potentially that this might have harmed in some capacity. I mean, I remember, when I have 4 daughters, when, with 2 of the new marriage, but when I was, a young father with my first children, they get sick, they get a fever. What's first thing I'm doing? I'm giving them a dose of Tylenol, right? The liquid, grape Tylenol that you buy in bulk from Walgreens and all these other places, because there's a trust in the whole thing. And had I ever been, because I'm a medic, I'm a classically trained civilian paramedic. I was a medic in the SEAL teams. If I, was going to administer a drug to one of my guys
I'm going to do the research and figure out, right, what are the what are the biomarkers? What are the things I need? What are the dose sizes? Is there any, potentiality for a negative efficacy in this? You do all those things, but when it comes to these mega corporations, you just figure, oh, it's a no-brainer. There's never been a problem. There's no whatever. But now we absolutely know that there's a symbiotic relationship. Did you find any type of money correlation to Tylenol, people that were in these studies? Did you find any a financial integration with Woodcock or any of these other people? I mean, like I remember in the Peter Berg, documentary or documentary or drama mockumentary, whatever they call those things, when about the Sackler family, there was that one FDA person that went into the hotel room for 48 hours or whatever it is and came out on the other end and was like approved. What did you find any other connections? I mean, obviously as investigative journalists, probably like rule number one for y'all is follow the money, right? Did you find anything like that?
I asked the drug company Kenvue, did you have any communications with the FDA about this? Their strategy when it comes to my reporting has just been to ignore me. So they didn't answer that question. But we know that there's a financial relationship, and you don't need FOIA or an investigative journalist to tell you that. Actually, you just, understand that user fees mean that drug companies like Johnson & Johnson, now Kenvue, and other makers of acetaminophen are partially underwriting the budget of the FDA. So absolutely, baseline, there is a financial relationship. As to whether the company was lobbying the FDA, I think one of the cool things about the new leadership at the FDA is they've been doing these podcasts, which has been an insightful way to get a sense of what actually goes on. And they mention how drug companies lobby the FDA. They don't necessarily do it directly. They'll go to a lawmaker whose campaigns are, in many cases underwritten by the pharmaceutical industry and say, we're really concerned about this FDA policy. And then the lawmakers, who of course set the FDA's budget, who are in charge of their appropriations, will come to the FDA and say, hey, we're hearing this from the industry. What's going on over there? And that'll be sort of the indirect way of putting pressure on the FDA. So I thought that was super interesting. I didn't realize that was how pharma sort of exerts influence on the FDA often. But on the specifics of this case, I think we're still learning more. I definitely hope to learn more. As you mentioned, the opioid case is infamous, and Janet Woodcock overseeing CEDAR, the division of the FDA that oversees opioids, also overseeing this case. She doesn't have the best track record, so I think it's a reasonable question to ask. Another parallel, I think, to the case of OxyContin is there was one letter that was cited repeatedly, and it was really more of an op-ed that said this stuff is not addictive. And it kept getting cited in the scientific literature as this premier evidence that this drug was safe. In the case of Tylenol, there's something very similar where the American Academy of Pediatrics looked at liver toxicity of acetaminophen, and they said, well, it doesn't seem to harm the liver, so we think it's okay. And that gets sort of repeatedly cited as evidence that it's safe. But then one point that experts who are in favor of this hypothesis that acetaminophen causes neurological damage, they'll point to animal studies showing that mice will die from acetaminophen overdose without their livers being damaged. And we're not really sure how that happens. So much like the OxyContin letter, there is a similar sort of foundational publication saying that this drug is safe that keeps getting repeatedly cited. And I think it's time that we take a second look at that, the evidence there. So
I think you're 100% right. I mean, as you're saying this thing, all I remember is during COVID, right? Every CNN commercial was brought to you by Pfizer, right? Or, it was just one constant from all these so-called news organizations. And, and you see, the organizations that obviously don't take money from big pharma, such as the Daily Caller, and you're able to do good reporting on this because you're not constrained by the influence there. I want to go back to the class action lawsuit. I saw that they have another big hearing in November. Can you talk a little bit about that and what they're hoping to accomplish in that upcoming trial?
Sure. Yeah. So briefly on the ad point, if you map when direct-to-consumer advertising started by the pharmaceutical industry, and Johnson & Johnson, the maker of Tylenol, former maker of Tylenol, before they spun it off into this legally separate company called Kenvue a couple years ago, they were a big driver of that. And you map it against autism cases. Again, it's not we can't prove causation, but it's interesting that they dovetail. So there's this class action lawsuit. They were unsuccessful. Their first go round, essentially the judge said that the evidence doesn't prove causation, and thus we're throwing out all of the plaintiffs' experts in this case. They thought the firm was overstating its case.
And where was that case litigated initially? I'm sorry to interrupt you. Where was that case litigated? And do you know the name of the judge?
The Southern District of New York. Denise Coate, I think, is the name of the judge.
Okay.
So folks can independently look into
evaluate
her
record, which is a whole nother system that we have to evaluate right now with the justice system, like to not allow the class actions experts to testify. And then to in discovery to get a stack of redacted information for your case. It's just, it's a sham, the whole thing. It's ridiculous.
Well, and one thing I'll mention, I'll be even-handed here. So like the FDA documents we reported on, the experts said pregnant women absolutely need to be warned, but they also said we don't have causation yet, repeatedly. And my understanding from scientists is that causation is hard to prove. And so there is a possibility that the firm was overstating its case when it said that there is causation, simply because it hasn't been studied in the way that you would need to in order to prove it. And part of it is difficult because there are major ethical challenges with, studying pregnancy. Mm-hmm. So I'll say that to be absolutely fair here. One thing that's curious is that Biden's Department of Justice weighed in the case with a letter where they mention all of these FDA reports that we describe in our story, but they only cite one of them, and it's this 2023 epidemiology review. The expert who wrote that first initial report saying pregnant women should be warned, and then said that again and again in these other internal reports, he had moved on. He had started to retire. So it was this other official who wrote this 2023 report. And unlike every other prior FDA report that I reviewed, it didn't have a recommendation section at all. So it just said the association has not proven to be causal. And then didn't say anything else. So
crickets on
and that was the only one that Biden's Department of Justice, quoted from in its letter in this case. And so the defendant, the pharmaceutical company Kenvue, was able to say, the FDA says that there's no causal relationship here, nothing to see here. And in fact, the drug company has since, in battling the current FDA, the new leadership at FDA, the FDA has said in prior reports that there's no causal relationship here. Of course, omitting the giant red flag that every other report recommended that pregnant women be warned. So that's a curiosity, you might say. I do wonder how that happened.
Oh man, I think it's now so systemic of a tactic that it just, I mean, once you figure out how to generate liability for vaccines, you generate how to destroy these class action lawsuits through holding the trials in specific areas with specific judges. I mean, the whole idea of lawfare and how to play that game is become, a multi-billion-dollar business of it in itself. So, these are tactics that, all these companies have become, invested hundreds and hundreds of millions of dollars. And so, only by the grace of God and tenacious reporters like yourself, does it begin to percolate to the surface. What is you said there's going to be a follow-up hearing? Do they have, what's the word I'm looking for? They appealed the judgment, I'm assuming. And so they're getting up a follow-up hearing in November.
Yeah. So the judge or another judge will hear an appeal, and we definitely plan on covering those proceedings. So stay tuned. I think it's possible both sides will have surprises that weren't available in the discovery documents that I reviewed. So more to come, and hopefully, no matter what side is successful, the public gets more clarity on this.
Well, I'll tell you what, Emily, if you're up for it, when that next trial or hearing goes down and something pops out of that, we'd love to have you on. There's just a real quick. I have to just hit this because this caught my eye as I was going through your page and just reading through all your articles. There's one you reposted about an article from, what is it? Gardner Harris, an excerpt speaking about antidepressants and how a new finding is saying that potentially there's a link to suicide in kids for long-term use of antidepressants. Are you covering that? Are you doing a story on that? When's that going to come out? And where can people follow you and pay attention? Because you're just doing great work.
Thank you. I'm glad you asked about that because it's sort of a nuance that I couldn't get into in depth because I didn't want people to sort of totally lose the thread, but I think it's important in telling about the culture of the FDA. So this actually happened in 2003. The epidemiologist I keep mentioning, the rank and file head drug safety, over-the-counter drug safety expert at the FDA, who kept saying, hey, we need to warn pregnant women about Tylenol use. He, 20 years earlier or 15 years earlier, put together this report about children on antidepressants having a higher rate of suicide than children who were not depressed children who were not taking antidepressants. So essentially antidepressants having the opposite intended effect. And he was greeted by his higher ups at the FDA with harassment. He was not able to present his science at an advisory committee meeting. Those are open to the public, so this would have clued in the public to what was going on. And higher ups even tried to pressure him to change the conclusions of his report so that it,
wow.
So it wouldn't find this association. This all became public. There was a major congressional hearing, and the FDA, sort of through having their arms twisted, was forced to issue a black box warning about this risk. But, you kind of wonder, an institution with that sort of culture, would it be capable of being responsible for a cover-up of neurological damage of a major drug like Tylenol, I think it's safe to say they would be capable of something like that. So
I think they're capable of all of this and more, because it seems like every 10 years or so, we see where there's, catastrophic fails on their oversight for the American population and people. And I think they're over it. We're over it. We're just sick of it. Now we don't know who to trust. We don't know which doctors to go see who are going to push drugs, more vaccines and more drugs on us, and who's going to support these things. And because that's a huge component of their fund, how they make money is what they sell in terms of, prescriptions. And it all just seems like it's gone to the place where that moral flexibility has been, usurped, or that moral construct has been usurped by the power of the dollar. And man, I'm just grateful that you are out there pounding the pavement and digging into these stories. Emily, where can people follow you, and how can they get in touch with you if they have tips or ideas that they want to share with you about great stories involved in what you're reporting on?
Yeah, absolutely. So you can read my reporting at the Daily Caller, and then I'm on X at Emily Anne Kopp Kopp, and my DMs are open, and love to chat with folks about story ideas. So.
Awesome. Emily, thank you so much for what you're doing. Keep up the great work. And I'm looking forward to I'm going to be paying attention. If you get another big break, I'd love to have it. And one last thing, I do want to say that Secretary Kennedy did reach out to you and compliment you on one of your reporting, didn't he?
He did, yeah. His knowledge is pretty impressive. He was like, there's this guy, Mosholder. He knew the specific name of the FDA epidemiologist. So they're paying close attention to the science. And I hope, you mentioned doing your careful research. I think that's sort of where the corruption leads us, is us doing our own independent research in these things. And I hope folks continue to do their own research too.
They will. Thank you so much. And God bless you, Emily.
Thank you so much.